My name is John Wang. I'm an orthopedic surgeon at HSS in Florida. I specialize in hip and knee reconstruction, primarily surgeries for painful hip and knee arthritis. Most of the patients I see here are the people that have failed conservative treatment for their hip arthritis or knee arthritis. And usually these are the patients that come in having failed treatments or therapy or medications or myriad of conservative options that we can offer. And the pain is limiting them in terms of what they can do on a day-to-day basis, and their quality of life is suffering. So when patients first come in, I think what they can expect is that they are looking for some answers. They may not know exactly what's going on with their hip or their knees. We always try conservative treatment first before we venture into anything more aggressive. So usually we do a very careful exam to make sure that we're isolating out the location of concern, and we're also taking a look at all the imaging to make sure we're on the right track. Surgery can seem scary, and I certainly understand that, but I think with the advances that we've made over the last 10, 20 years or so, for the majority of times, joint replacement surgery has become really successful in terms of cutting down on the recovery time, making sure that the final outcomes are good, returning patients to activity. So even if patients need surgery, I usually really try to reassure them that most likely they're going to end up having a great outcome and be able to return to all their activities. Part of the advancements that we made in joint replacement over the last 5 or 10 years has included a lot of the use of technology, and I think that's important because I really think that the use of these technologies help the surgeons be more accurate and more precise in terms of how we do the surgery. So we're utilizing a lot of technologies like computers, navigation, robotics, just different things to help basically double check our work as we're in the OR so we could be better surgeons. I think it's very rewarding to see successful patients after joint replacement, and it's because we can see them getting back to the activities that they love doing. It's golf, it's tennis, it's pickleball, it's dancing, it's all sorts of things. And I think the quality of life really suffers when they can't do it, and I think when you're able to be a part of the solution to get them back to where they want to be, it's just incredibly rewarding.